Hi, everybody. Welcome back. We are live for our second set of Learning at Home series today. We are beginning the first of a three-part series entitled Before, During, and After, the halachic, hashkafic, practical, and medical advice for the special time of pregnancy and childbirth. Today, we're specifically focusing on a difficult subject, but very necessary, and that is guidance and support for pregnancy loss, both from the perspective of somebody unfortunately experiencing pregnancy loss or someone providing support for their sister, their friend, whoever is in your circles of life. With us tonight for this very important subject is Mrs. Chumi Friedman, the director of AHUG, which is a Times division for pregnancy loss. I just also want to mention, for those of you who are in Crown Heights specifically, there is a pretty new organization which has a wonderful initiative of a week's worth of meals, meal train for a woman suffering from pregnancy loss, as well as some, flowers donated by Mamulo and a few other things. I will post their contact in the comment box for you to be, if you or someone you know needs to reach out to them for the support that they need, please do so. I also like to welcome everybody to please follow us on Facebook at mikvah.org or on Instagram at mymikvah to be up to date on all of our latest classes and to know exactly what's going on next. So without further ado, I'm going to welcome Mrs. Chumi Friedman.
Hi, Hasi, how are you? Thank you, everyone. Oh, this is like a whole new world with this Zoom business. Thank you all for joining us tonight. Sorry, I'm just trying to get my notes on one part of the screen and me on the other part of the screen. So my name is Chumi Friedman, and I am the director of ATIME's HUG program. Let me tell you a little bit about HUG, what we do. Some of you may know that ATIME is an organization that supports couples who are experiencing infertility, from couples who are walking the infertility journey. They've been around for about 27, 28 years. And HUG was started about 17 years ago. Rabbi and Mrs. Rosen had a full-term stillbirth, and at that time there really were not any resources, for sure not in the frum world, and even what existed in the more secular world was really not much of anything. And they were in the hospital having just delivered a baby, and they didn't know what they were allowed to do, what they weren't allowed to do, what they could do. Could they look at the baby? Could they hold the baby? Kfura, how do they go home and tell their children what's going on? And Branio says she left the hospital and said, how does this make sense that there isn't a place? And so it took a number of years for them to formulate the HUG program, which we have today. And we have, in the close to 3 years since I have been running HUG, I can only, speak to what we've done since then. Thousands of couples have reached out to us, whether it is in regards to a miscarriage, a stillbirth, a baby who unfortunately will not live longer than 30 days, some complications in high-risk pregnancy sometimes. So that is the HUG program. So tonight is about pregnancy loss, about miscarriages, stillbirths. So I was 19 years old. I was newly married. We were a group of couples. Our husbands had all gone to yeshiva together. We all got married around the same time. And everybody was getting pregnant and having babies. And then one day, so was I. It was very exciting. We were only married a few short months. And I think I remember being excited, had my doctor's appointment. Don't let my looks confuse you. This was more than 30 some odd years ago. So in those days, it wasn't like today where they tell you not even to come in for, your first appointments until you're about 7, 8 weeks, sometimes a little bit later. Then you went, you were 2 weeks late, you took a pregnancy test. Like they said, the rabbit died, and so you went in. So I went in, and everything was good. Blood test, everything came back great. Doctor examined me, everything was fantastic. And then I started staining. Called the doctor. I went to an imaging place, and I remember the technician handing me the phone. My doctor was on the phone, and she said, there's no heartbeat. There's nothing, it's over. And I don't remember an incredible amount about that day, but I remember I went out of the building, and I am the oldest on am the oldest grandchild on both sides, my mother's side and my father's side. So my getting married was a big deal. My getting pregnant was a big deal. Everybody knew. And we didn't have a car in those days. My grandmother and my aunt were waiting outside. And I remember getting into the car and crying, I think, and saying that, that it was over. And my grandmother was really a wonderful woman, said to me, well, at least you can get pregnant. We'll discuss the do's and don'ts a little bit later on of what you should say, what you shouldn't say. Yeah, that's one of the things we don't say. I remember feeling a tremendous amount of sadness, really a tremendous amount of sadness. And then life continued, and Baruch Hashem, I was blessed to have 4 children. And then when my youngest was 4 at the time, I got pregnant again and had a loss. And then got pregnant again and had another loss. And then got pregnant again and had another loss. It was less than a year, 3 losses. And I remember the last pregnancy, I started staining and called the doctor, and he said to come in to meet him. He was at the hospital. It's Beth Israel on the Lower East Side. And we went to the hospital. It was one of the shortest Fridays of the year. It was the middle of the winter. And we were having a house full of people for Shabbos. We went to the hospital. He did a sonogram, and he said, it's over. There's no heartbeat. It's finished. I'm not sure why we did the DNC. It was a different world. And I had my DNC that day. And anyway, it's sort of like remembering waking up Shabbos morning and just looking out at the scene. It was quiet. They let me stay in the hospital. It was literally Nisim that I stayed in the hospital, because the last thing the doctor said to me before he put me out was, they're not going to let you stay. This is an outpatient procedure, and you're going to wake up, it's going to be Shabbos already, and they're going to tell you have to go home. So you're going to say you're not feeling well. And hopefully they'll let you stay overnight. They'll probably keep you in recovery overnight. And then in the morning, you and your husband, you'll just spend Shabbos day hanging out in the lobby. And I remember I woke up in recovery, and my husband was sitting there, and he said to me, it's Shabbos already. And a nurse walked over, and before I had a chance to say I wasn't feeling well, which I wasn't crazy about doing because I really didn't want to lie, but she looked at me and she said, we're going to be moving you upstairs. And they put us in a private room. No one, literally, they didn't bother us the entire Shabbos. Much Shabbos we left the hospital. It was really like an oasis in time. And for those of you who are just curious, no, I never had any more children. We never found out why the losses took place. In those days, we really didn't do testing. And I sort of made my peace with it. Baruch Hashem, I have 4 healthy children, and I have houses full of grandchildren. So Baruch Hashem. So that's why Hug exists. That's why I'm here. So how prevalent are losses, right? If we're going to talk about miscarriages, we're going to talk about stillbirths, how prevalent are they? So medically speaking, sorry. I don't know how to get rid of this. No, hold on. Okay, I don't know what this is. Wait. Hold on. Sorry. I'm gonna ask my husband to just come here and help me get rid of this window. Never mind, I think I did it. Okay, sorry about that. So how prevalent are losses? Medically speaking, one in every, okay, great. Okay, and medically speaking, 1 in every 4 pregnancies is a loss. And so it's really like, let's stop for a second. 1 in every 4 pregnancies. So that means when you get pregnant, there's a 25% chance it's going to be a loss. And in many cases, in most cases, we never learn the reason why. And that's because first of all, we don't test most of the time. 1 loss, we generally don't test. But there are some possibilities to just keep in mind. So usually in most cases, if we would test, we would find out they were chromosomal abnormalities. There could also be some structural issues with the uterus. And how would we know that before you get pregnant? We wouldn't know. So generally speaking, if a first pregnancy is a loss, and it's a little bit later on than just a very early loss, there could be structural issues that we want to look at. Certain medical conditions can make a woman more susceptible to losses, and clotting factors. So those are the general reasons that a woman will have a miscarriage. A stillbirth comes in sometimes to other issues, sometimes some of these same issues. Full-term stillbirths, generally speaking, in a lot of cases, are cord-related issues. Now, all of that being said, as Torah Jews, we look to the Torah for answers. So how prevalent are losses, and what, if anything, does the Torah tell us about losses? So we know that in the time of the Beis Hamikdash, the Kohen Gadol entered the Kodesh HaKodashim once a year on Yom Kippur. It was a period of great awe and inspiration, because if he stumbled in his words, if his avoda was not accepted, then he wouldn't come out alive. What did he daven for? He davened for rain. I don't remember the third thing, I'm sorry, but among the things that he davened for on this incredibly auspicious day was the following. Shana shalo tapil isha pri bitna. He asked for a year in which a woman would not lose the fruit of her womb. In other words, he davened that no woman should have a miscarriage. So how prevalent are losses? So prevalent that on the one day of the year in which the Kohen Gadol entered the holiest place on earth, he davened that a woman shouldn't have a miscarriage. So we arguably can say that loss has been built in to the fabric of creation. Why? We don't know. That being said, I will tell you what Rav Chaim Vital says. As a matter of fact, I'm going to actually read to you some words written by Rav Zachariah Wallerstein, a very old friend of ATIME, who has experienced, he and his wife have experienced their own journey with losses. And I'm going to read to you what he says. Whenever I am asked by parents for support and encouragement, I am reminded of the words of Rav Chaim Vital, who says something so important to remember. Many great Gedolim have been noted to, We know that many great Gedolim have been, they note, right? They would stand up when a special needs child would come into the room, because they said that these are special needs children have very, very holy neshama. Rav Chaim Vital tells us, what is it about these special neshamos? These are neshamos that need some sort of tikkun. They go up to Shamayim and they need some sort of tikkun. And the neshama, though, is concerned. If it's going to be forced to come back to this world, maybe there's a chance that it's going to sin again. And then it's going to, keep regurgitating this cycle. So HaKadosh Baruch Hu has created this situation in which these neshamos will be given the opportunity to come down and to be mitzaken and not have any opportunity to sin in any way. So this is what Rav Chaim Vital tells us happens with these neshamos that are stillborn, these neshamos that are the product of a pregnancy that is a miscarriage. Whatever it is, whatever tikkun that the neshama needs, it is able to get through this process of coming down for a short period of time, not being born, and then the neshama goes back to Shamayim. Interestingly enough, Rav Chaim Vital says, it's wonderful for the neshama. The neshama is getting its tikkun, but what about the parents? Why is it that parents are being forced to suffer sometimes unspeakable agony and suffering? And why are they being used as a tool for a neshama's, fixing? So Rav Chaim Vital says that Hashem runs the world measure for measure, and everything is calculated by HaKadosh Baruch Hu. When he says that they may suffer, hear these parents. But when these neshamos, when the neshamos of the parents, Acharmei ve'esrim, go up before Kisei HaKavod, the neshama of that child whom they carried is waiting there for them. And that neshama says, look what they did for me. They allowed me to be metaken so that I can go into Gan Eden. And the neshama pleads for them. And I've heard it said, not just then, not just Acharmei ve'esrim, but that this neshama is connected to us. It is somehow or another, our souls are connected to its soul. And it's interesting that Rav Moshe Shapiro, Zecher Tzaddik Livracha, told this to Rav Menachem Nissel, that we shouldn't think it's a random neshama that comes down. If I have a loss, that neshama that came down to be metaken in me is somehow or another connected to my neshama. And the suffering of the parents, especially the mother, he said, is an intrinsic part of the tikkun. We don't really understand what any of this means. I think what he's trying to say, what I think the most important thing, what I want you to know, is that the suffering is never in vain. Very often we hear people say, there was no reason for this. It just happened. It's not a Torah perspective. A Torah perspective is that everything happens for a reason. We may not know what the reason is. We may never get 100% clarity on what the reason is, but we don't believe that anything ever happens for no reason at all. So now, we talked a little bit about why loss happens. And so now, what do we do when the loss has happened? What do we do for ourselves? First, we're going to talk about what we do for ourselves, and then we're going to talk about the greater population. So very often we get phone calls from women at any stage in a loss, and they're really struggling with their emotions. It could be anything from, I don't know why this is hitting me so hard, to I'm crying all the time. I don't want to leave my bed. No one understands me. People tell me I should be past it. I once had a woman actually say that to me. She said, everybody's telling me I should be over this. And I said, it was one of the first things she said to me on the phone. And I said, do you mind just telling me how long ago you had your miscarriage? And she said, a week ago. I said, a week ago? Who was telling you should be over this? And then she proceeded to list many family members. So we'll talk about that a little bit later. But one of the things that I think we have to remember when we are suffering a loss is the importance of being empathetic to ourselves. So what does that mean? It means that we need to treat ourselves the way we would be treating somebody else. We need to recognize that we are in a fragile emotional state and that is okay. Now, let me just say, if you're not in a fragile emotional state, that's okay too. There is no right or wrong way to do this which is grief, which is sadness, which is bereavement, which is anger, which is confusion, which is anxiety, which is a sense of betrayal, a sense of, that I've lost my hopes, my dreams, my wishes. I once had a husband call me And he said, we got married 2 months ago, he said, and we just had a loss. So they were, I think, about 5 weeks along, something like that. And he said to me, which one of us is crazy? So I said, well, what do you mean? So he said, she's sitting in the closet crying, and I'm sort of like laughing. He said, so which one of us is nuts? I said, neither one of you are nuts. I said, you are just, I said, it didn't really mean that much to you yet. I said, and her, from the moment she saw those lines on the pregnancy test, said in 5 minutes, she went from seeing that to walking this child down to the chuppah. So there is no right way to do this, right? Neither one of them was crazy. There's no right way. There's no wrong way. It just is. It is just about making space for your emotions. And I want to just for a couple of seconds touch on all of the emotions that we may be feeling, right? So the most prevalent emotion that we feel is sadness. Why wouldn't we be sad, right? It could be that we are, sadness. So why wouldn't we feel sad? It's the loss of, like I said, a dream, a hope, a wish. Maybe we have a house full of children. But when we find out we're pregnant, we're already restructuring how the household is going to be when that baby comes, right? We're already doing that when we're newly married. So we're just starting to build our lives. So there's sadness, but mixed in with the sadness could be a little bit of, really? So soon? I thought we were going to have a little bit of a more time together, more of a chance to get to know each other. And so there's this little bit of like, okay, I'm so happy that I'm expecting. And now when I've had the loss, so I'm sad. But mixed in with the sad is a little bit maybe guilt, because maybe I didn't want it enough. Maybe for like those 10 seconds, I thought that it was too soon, or even if I have a house full of children. And when I found out I was pregnant, there was that moment that said, ah, shucks, really? Okay, we'll make it work. But there was that ah, shucks moment. So there is sadness, usually overwhelming, and mixed in could be guilt when we've had the loss, depending on what our feelings and emotions were. I actually spoke to a mother once mother was the one who reached out to call me, told me that her daughter's having a loss and how can I help her? And when I said to her, we were talking about how long they were married and what was going on. And I said to her, and by the way, it could be that she feels guilty. She got very quiet. She said, what do you mean? So I said, well, if she was kind of thinking, I wish I didn't get pregnant so fast, and now she's miscarrying, she may feel like she caused it. And she said, that's exactly how she feels. She feels like she did it. In her head, she feels like she did it. So there's the sadness, there's the guilt. Sometimes there's overwhelming sadness. Sometimes there's grief. Maybe we've been waiting for a long time. Maybe we've been experiencing infertility and we finally got pregnant. And so we're devastated because it's not just a loss. It's everything. It's everything that we've been experiencing. And sometimes the grief weighs us down so heavily, we don't know how to function. That can also be the case when we're talking about a later loss. A stillbirth, by the way, is defined as a pregnancy from 20 weeks and on. So the loss of a pregnancy from 20 weeks and on is considered a stillbirth. So that comes with a whole host of feelings sometimes too. That's a little bit even more. Many women will say, one loss, an early loss, 6, 7, 8 weeks. It really wasn't that connected yet. And okay, it happened one time and I'm sort of like going to be okay. A lot of women say, I think I'm okay. If it's a second loss, then that adds to the feelings. If it's a later loss, there can be a tremendous amount. I will just say losses that have happened now, since Purim, during this pandemic that we have found ourselves in. Losses that have happened now come with so much more intense emotions. At least that's what we have found, because of what we've all been experiencing. So it just sort of intensifies what's happening to us inside. So much about our lives is out of control, and we don't know what to do with it, and everything's up in the air and what's going to be. And so when we have a loss, it just, everything sort of like runs together. The other thing that I want to talk about is one of the emotions that we could possibly feel is anger. And anger at HaKadosh Baruch Hu, because we had a dream, we had a wish, and it was taken away from us. And sometimes what we feel is, what did you even let me get pregnant for? You didn't have to. Could have just continued on like this. I would have been sad. I would have been frustrated, but I wouldn't have been this. I wouldn't have been grief-stricken. Why did you build up my hopes and my dreams? And why did you let me think I was going to have a baby, right? But when we grow up in a frum system, a lot of times we don't know what to do with that anger. You know, there's an expression, I sat with my anger long enough until she told me her name was grief. But sometimes it is, obviously, at the end of it all, it's grief, but it is anger. Sometimes it's a sense of betrayal. There are women who have said, I can't pick up my sitter. I don't know. I don't know what to say. I can't, the words have no meaning to me. So what I'm here to tell you in terms of that is, number one, that's okay. It's okay to be angry. It's okay to feel any of your emotions. Emotions are not right. They're not wrong. They're not positive. They're not negative. They are. What is positive or negative, what is right or wrong, is what we do with those emotions. I heard Rabbi Y.Y. Jacobson recently say that we should never be afraid of our emotions, that HaKadosh Baruch Hu is emes. He is kulo emes. And so what he wants from us is emes. What am I feeling? What is going on inside me? That's what HaKadosh Baruch Hu wants. Our lives are about relationships with him, relationships with our spouses, our families, ourselves. And the foundation of those relationships have to be truth. And so if you're angry, you can say, I'm angry. If you can't pick up a sitter, you can say, I don't even know how to talk to you right now. I'm not sure what to say. I don't think I want to have a conversation with you. When we are hurt, we very often don't want to talk to the person who's hurting us. And here, the hurt is being done by the only being who is capable of giving us that kind of hurt, and that is Hashem. So just some thoughts, all from Rabbi Jacobson, who, by the way, is amazing. You are larger than your emotions. You should never feel the need to judge yourself, to feel guilty or to deny what you're feeling. At the same time, we shouldn't be letting our emotions control us, right? I can say, today, this is really hard for me. And let me tell you, doing what I do, there are days that it's really, really hard for me. I try to focus when I daven 2 brachos, because at the very least, I try to say brachos every day. So 2 brachos that in which whatever's going on, I stop. And that number 1 is the bracha of Shasani Kirtzono, because it is not just, right, the opposite of what men say, right, which is Shelo Asani Isha. We say Shasani Kirtzono. Thank you for making me what you wanted to make. But it's, you made me, Shasani, you made me according to your will. So everything that I am, all of my experiences, all of my feelings, the genetic patterns that were set up in my head, right? The way I react to things, the things that are nature within us. That's what HaKadosh Baruch Hu put in us. And then he created the experiences that we're going to go through. So everything that happens, if I get angry easy, it's because he created that in me. Now, yes, I have responsibilities. I have an achayus to deal with it in the proper way, but it's an etios that he created in me. So Shasani Kirtzona, when you can say that, say HaKadosh Baruch Hu, I am what you created. So work with me here. And the other one is Sha'asali Kol Tzarki, is that everything that's in my life, the quote unquote good and the quote unquote not so good, is also what he set into place for me. So don't ever feel that you have to put on a smile for HaKadosh Baruch Hu. HaKadosh Baruch Hu doesn't need our smiles, and he doesn't need for us to be fake. He needs for us to be real in whatever that means for you. And it's also a very, very important thing in our relationship with our spouses. We need to be real with our spouses. Men and women very often, as we said, come at things from different perspectives. He may think like, okay, it's a loss, it's sad, but okay. And she can't function. And that's okay. We had a woman ask us last night in one of our support groups. She said, so 4 weeks past the loss, he's over it. Is he ever going to not be over it? Like, is he going to start feeling sad again? And I said, well, we don't know your husband, so we can't say for sure. But it could be not. It could be that he's reached a place where he's okay. And that's okay that he is, even though you're not. Generally speaking, men are fixers. And so they come at it from the perspective of, okay, it's my job to take care of her. And so what can I do to make you feel better? Which is why sometimes you will have a situation in which you'll think, why doesn't he get that I'm still upset? Because he wants to fix you. He gets that you're upset, but he wants to fix you. Okay. So it's important to connect with your spouse and to give him the same space that you need for yourself. So those are important things. Empathy for self, right? Allowing yourself to feel your emotions, to connect with your emotions, to find a safe space for yourself. And a safe space means a person. Generally speaking, it's a person, or it could be an inanimate object. So a safe space could be your journal, someplace where you write everything down. You should have that for yourself, or a person, one person that you could pick up the phone to at any time, and that person really, really gets you and understands you and is willing to just listen and empathize with you. Those are very, very important. The other thing to remember is that grief is not linear. Grief is like a wave. So you could be surfing and the water is calm and everything seems to be okay. And then out of nowhere, a wave comes and throws you over. And if you're going to fight the wave, you're probably going to drown. So grief is that wave. And when it comes, you've just got to ride it out. And I would say this very, very interesting story told about the Majitz Rebbe, Rav Shaul Yedidah Elazar Taub. Somebody met him in Vilna during the war in 1941. It was a crazy time in Vilna. And he said to the Rebbe, he said, why do you look okay? Like, you walk down the streets, there's like a feeling of tense and nervousness and anxiety, but you look like you're besimcha. You're not tense, you're not angry, you're not nervous, you're not. And the Rebbe said to him, of course I am. I'm all of those things. He said, but what does it help for me to walk around feeling like this all day? So I give myself a certain time, like a certain time every day in which I take out all the anxiety, confusion, grief, sadness, whatever it was, and I allow myself to feel it. And then I put it back in the box and I go about my day and I do what I need to do and I take it out again. And it's something we tell women all the time. Create that safe space. So either it's going to be a person, like I said, maybe you're going to journal, maybe you're just going to say, okay, for the next 6-7 minutes, which is sometimes hard if you have other people in the house with you, say, this is my time. I'm going into this room and I'm closing the door and please don't come in. and then take out your feelings and your emotions and deal with that. We're going to move on to when others have loss, how you can assist others. But before we do that, I just want to go back, because we've been talking a lot about miscarriages. So a miscarriage is from a chemical pregnancy, quote unquote, is very, very early, 4 or 5, not even 6 weeks, 4 or 5 weeks. It's a missed period, and then she's a little late. Maybe she took a pregnancy test, it was positive, and then she starts staining. From about 6, 7 weeks until 20 weeks is considered a miscarriage, and after 20 weeks, it is considered a stillbirth. If a woman is having a miscarriage, an early miscarriage, up until about 10 to 11 weeks, she may be given 3 options by her doctor. Option number 1 could be to let it pass on its own. That will depend on what a sonogram has told them a baby is measuring, because she could feel that she's at 10 weeks, right? She could, from her last monthly period, she is 10 weeks along, but the baby's measuring 6. So that means that the baby possibly stopped growing at 6 weeks. So then 4 weeks already, nothing's happened. Her body should have known what it needed to do, and it didn't. But sometimes a doctor will say, we can wait it out, especially if we've already started cramping a little bit or staining a little bit. A doctor may say, let's wait it out. Let's see what happens. Second option could be medication. Cytotec or metoprolol, it could be called, and that is usually inserted either orally or vaginally. It takes a few hours to work, and then usually the cramping starts, and then the bleeding. The bleeding can be somewhat heavy. There is a risk of hemorrhage. It's a very small risk, but we do like for women to know that, and that means that if you or she has to change a pad more than 3 times in 3 hours, that's a problem. Meaning it's more than once an hour, 3 times. That's a problem, and you need to immediately call your doctor. So letting it pass naturally could be an option. Medication could be an option. With both of them, there is a chance that it won't work, meaning that your body naturally just will not do what it needs to do. And at a certain point, it becomes harmful for your body to just have what is no longer a baby inside you. And the medication sometimes doesn't work either. So we take the medication, it doesn't work. And so then the third option is the D&C. The D&C in most cases is a surgical procedure, but it is a short procedure. There's some work beforehand. They won't let you leave afterwards until you're awake, you've gone to the bathroom, they see that you could walk around. So we always tell people to approximate 4 to 5 hours from when they go in until when they leave. But it's a surgical procedure. You're being put to sleep. There are some doctors that will do it just by numbing the cervix in the office. Some women like that, some women don't. I have mixed feelings about it, but I would be more than happy to discuss that with anyone on their own specific basis. Anything past 12 to 14 weeks is going to be a D&E. I will say I had a woman just recently, she was 20 weeks along, and they induced her. I was a little bit surprised, especially because the baby was measuring much earlier. The baby was measuring, she was at 20 weeks, the baby was measuring at 15, but they induced her. That was the decision, that her doctor didn't even give her another option. There are places, even here within New York, the doctors don't do D&Es, so they're gonna wanna do an induction. An induction, depending on where you are in the pregnancy, could take up to 24 hours. My experience is if a woman is at somewhere between 20 to 28 weeks, it usually takes about 6 hours, but it can take longer. There are halachic implications when the baby is past a certain week. 8 times psak halacha is that you need kfura at 14 weeks, but I always say, please speak to your dayan and let him tell you what you need. We do have a process in which we take care of Chavra Kadisha, if that is something that you need. So you can always reach out to us for that. And I want to go back to the support. What does support look like for someone else? What I'm not going to touch on, just because maybe I'll touch on it for 2 seconds, is terminating a pregnancy. Terminating a pregnancy is a conversation that would take place if there was some sort of genetic issue. If we did the 20-week anatomy scan and they found something wrong, and then we find out that there's a genetic issue, and then it's a conversation that should take place with your DIAN. This is the POSAIC that you don't turn to for Milchick's inflation questions. This is, you want to know that you're speaking to someone who understands reproductive health and who understands all of this, knows what's going on. We can 100% put you in touch with someone if you want, or you can have your DIAN call our DIAN if he has a lot of questions. And then those decisions are discussed. What I think is important for people to know is that the question can be asked, and it is a conversation that you can have, and sometimes that you even should have. Okay, so now going back to how do we, as a larger community and as family members, support people, support women and couples who are experiencing a loss? The first thing, I think, is making sure that she knows and that he knows that they are not alone. No couple should ever feel that they have no one to turn to. That is an absolute horrific thing, because as it is, there's so much involved here. They need to know that there's someone that they can call. There's someone that they can turn to. And for many of us, it's our family that we turn to first. So that's really, really important. My mother asked me just the other day, what can I do? What do I do? What can I do for my daughter? And I said, whatever she needs. It's not about, when you're the family member, it's not about you. It's about her. It's about him. It's about what they need. And what you need to do is navigate around that. So it may mean that she's coming to stay by you, and that she wants to lay in her bed all day. And you think that's not a good thing. It doesn't matter. It doesn't matter that you think it's a good thing. It could be that you think it's the worst thing in the world for her. It doesn't matter. For right now, at the beginning, she needs to do what she needs to do. Yes, there could be a conversation if it's going on too long. I'm not sure what too long would be, but there can be conversations about at what point is it a mental health issue, and we need to make a mental health referral. But at the beginning, especially in the first week or two post-loss, it's going to be whatever she needs. Sorry, just getting some notes. Okay, never say you were only X. You were only a few weeks along. Never say it's only only an early loss. It doesn't really matter. Or if you knew what I had, please, what I had was 1,000 times worse than this. It's not about you. It's all about them and what they need. What you need to do is be empathetic. You need to be caring. You need to validate whatever it is that she is experiencing. You need to do the same thing for him. Fathers very, very much get lost in this, and we never, ever want them to sort of feel as if they don't have a place. I had a couple that had had a stillbirth, and I reached out to the father. I actually reached out to the father because I couldn't reach out. Mother wasn't answering the phone, so I called him because I wanted to see how they were doing. And he answered the phone, and I said, "How are you?" And he said to me, "I can't believe that you called me." He said, "Nobody's calling me." He said, I don't even know what's in. He was so sweet. He said, "Everything is about her." He said, "People are sending food to the house and everything's like, dear her, and like I'm not here." He said, "Nobody's asking how I am." So So it's very, very important that the couple feel that there is space for them. Let them have as much time as they need, and let them just be. I tell mothers when they're dealing with their daughters, it's not about you. And even though you're grieving, because you're going to be grieving as a grandparent, she can see you cry. She can see that you're upset. But she can't see you break. So those are really, I think, the general rules. Now I'm going to go over to some of the questions that I have been getting. I'm more than happy to talk emotions if you want. So you can submit the questions and comments. So some of the questions that we have gotten, let's see. Can I describe what a D&E is? I'd rather not. I'm a huge fan of Google, and you can Google what you need to Google, but I always think, mothers, we don't need this image in our head. Just accept that your baby is being taken out. Some of you, okay, maybe I'm going to take a step back. Some of you may have heard that in a D&E, the baby is not taken out whole. So one of the things that we work very, very carefully on at ATIME is the people that we make referrals to, because we want to make sure that you're seeing someone who is going to respect your feelings, your religious sensitivities, and your own feelings. And depending on the size of the baby, that may not be an issue. So depending on the size of the baby may be able to be taken out whole, and you can always tell whoever is doing the D&E, this is really important to me. Please make sure the baby is taken out whole. So it is an issue. However, very often it can be dealt with. Saying goodbye to the baby. So if you have had an induction at any point, right, whether it's a full-term stillbirth or even early, I mentioned to you earlier that I had somebody who was induced, but she was induced at 20 weeks. The baby was measuring 15. I really didn't think that there was going to be anything for her to see because it had been so many weeks, but there was. The doula called me, and I'll talk about doulas in a minute. The doula called me and she said to me, "Chumi, what do we do?" So I said, "Well, have you seen the baby?" So she said, yes. The baby was whole in the sac, and it looked like a tiny little doll. And I said, well, if they want to hold the baby, then 100%, that's what we should do. And that's what they did. The nurse opened the sac and took the baby out. And both she and her husband held the baby. So it is 100% halakhically acceptable, halakhically permitted for a mother and a father and grandparents and aunts and uncles, whoever it is that comes along, to hold the baby. Sing to the baby, say Tehillim, tell the baby, and anything that you would have wanted to say. We have a beautiful Michtav Preda that we send out in our packets. We send out packets for pregnancy loss, and we have a beautiful Michtav Preda written by a father, a Chassidish father, to his stillborn son. Have those conversations. There's no limit, no time limit on how long you can be with the baby. And even if they take the baby away, most hospitals will make allowances to bring the baby back. And halakhically, there is no time limit. The Chevra Kadisha will be contacted and they'll give you whatever time that you need. So that is not an issue. I will tell you, I can't speak for every Rav, but our Dayan has made it clear to me that a mother can even do skin to skin with her stillborn child. So that is not a problem. Are there any risks for D&C? The risks for D&C are, number one, as in any surgical procedure, right? The regular surgical procedure risks. And depending on how the D&C is being done, we do want to make sure that it is being done by somebody who knows what he or she is doing. We want to minimize the risk of infection, of anything being retained, anything that could, affect a later pregnancy. So you're not just going to go to anyone. I would always say, please reach out and let's make sure you're getting a good referral. Are there doulas available for labor that is already known to be a stillbirth or loss? The answer is yes. We have a whole host of them. We have trained quite a number of women in various parts of the country who will go and be with a couple through a stillbirth, through an induction. In Crown Heights, we have Freddie Lee Brow is one of our doulas, but we have them in Baltimore, we have them in Lakewood, we have them in Arsustral, I'm pretty sure. We have them in Muncie, we have them in Brooklyn, I have them in Houston. So absolutely there are women who are trained to do this. And I'm always open to doing a training. We did one in January, maybe right after Sukkot. We did one in Monroe, in Muncie for a group of Monroe doulas. So we are definitely open. And yes, there are doulas that are specifically trained to do this. Does birth control cause miscarriage? The answer is no. I would say that these questions can be answered by our Chava helpline. You can always call them, but the quick answer is no. Birth control does not cause miscarriage. Can one get pregnant as soon as you go off the pill? Yes, the beginning of an IVF cycle is birth control. It's a month of birth control. So the answer to that is yes. And the Chava helpline is 718-475-1415. And Chava is the ATIME's division that focuses on women's reproductive health. Everything from birth to menopause, they answer birth control questions almost all day. Statistics about first pregnancy results in miscarriage more often. No, again, miscarriages are 1 in every 4 pregnancies, but it's not that there's a greater chance in your first pregnancy. No, absolutely not. I spoke to a woman tonight who called me for support. She has 9 children. This is her first loss. So it is not more prevalent in first pregnancies than in any other. Okay. What is a normal amount of time to take off work after a loss? This is very, very general. I'm going to give you an example. We once had 2 women in the same week contacted us. They had both had losses. Happens to be they worked in the same office. Maybe they need to check their mezuzahs, but they worked in the same office. And they were both late losses. They had both been visibly pregnant. And they were both ready to go back to work after a week. And one called me and said, I don't know what to do. I don't want them to talk to me about it. I want to be able to go to the office and I want everybody to just pretend that everything is normal. And the other one called me and she said, I'm ready to go back. And really, I'm okay talking about this. Like, how do I let people know I'm okay talking about this? I started laughing. And I ended up calling the supervisor and saying, listen, I just want to let you know, this is how she feels and this is how she feels. Please navigate the office for her. There is no normal amount of time. After a procedure, right, after a D&C, for example, women will say, well, how soon am I going to be back to myself? So usually 1 to 2 days. And then you're feeling okay. I would say when you get home from the procedure, make sure you're resting, make sure you're drinking a lot of fluid, you're eating right. By the way, eating right to me means chocolate. Chocolate is like the healthiest food. It is like grief food and sad food. There is something to be said for it. We give it out in our loss packets. When can you go back is really up to you. As long as your doctor says physically you have the all clear, then emotionally some people find the distraction to be unbelievably helpful. Others find they just need more time in their house. There's no set time for that. Okay. How do you go through a pregnancy after loss without anxiety the entire time? You don't. It's hard. It is really, really hard. I spoke to somebody about it once. I spoke to one of my daughters. My daughter had a loss in her 5th month. And when she got pregnant, the next time she told me, we never talked about it. I mean, we talked about it because obviously we had to talk about it, but we didn't talk about it, right? She wouldn't talk about it. And we didn't talk about it until she had another child, and that child was at least 6 to 8 months old. So when we really talked about like what she had felt, what had happened, how she navigated. I just had to give her and her husband a tremendous amount of respecting their boundaries that they laid out and just doing what they let me do. And that was it. And she said to me, yeah, I was scared. I was really, really scared until I got past the point of when my loss had happened. So I will tell you a story. We once had a woman speak for us at ATIME. So her first loss was early. And so the next time she got pregnant, she just had to get past that. So she did. And then she had a second trimester loss. And so the next time she got pregnant, she said, well, I just have to get into my third trimester and then I'm going to be okay. And she did. And then she had a full-term stillbirth. And she said she had children at home. She said, how do you get past the stillbirth? Because the only thing that you can do is get to the point where you're holding the baby in your hands. And so, yes, she was anxious. She was scared. You need a lot of support. You need a lot of validation, a lot of self-validation, and a lot of supportive validation. And sometimes it means you need to speak to a counselor. And we do have some counselors that we refer to who do specialize in the post-loss anxiety, pregnancy after loss anxiety, which, by the way, in the secular world is referred to as a rainbow baby. And I've never quite understood why, because we know what rainbows mean to us as from people, not a good thing. So I'm not sure why they call them that. Why do some people feel that early miscarriages, you must go to a hospital? You don't must do anything. You want to make sure that you're getting good, sound medical advice for you, for your specific situation. The only time you have to go to the hospital is if you're hemorrhaging. Otherwise, you don't have to go to the hospital. If you're hemorrhaging, if you're not feeling well, if your cramps are horrific, if you're dizzy, nauseous, you should be on the phone with a doctor and then taking it through there. Do I need to call a doctor for any bleeding in pregnancy? While bleeding in pregnancy can be very normal and doesn't have to mean anything, we want to just be sure that it doesn't mean anything. So the answer to that would be, yes, call your doctor. I remember one of my obstetricians once telling me, it's not your place to decide what's an important question. I'll decide. You call me and you ask me. And if your doctor is not somehow you could be calling, you can always call us. But one of the first things I'm going to say is, tell me what your doctor said, because we can talk about what your doctor said, but he or she is your doctor. So I want you to reach out whenever something is happening that could be problematic. Okay, can you please discuss signs of an ectopic pregnancy? An ectopic is not necessarily more dangerous. More dangerous than what? That we didn't say. An ectopic pregnancy can sometimes be, some of the symptoms could be that your HCG levels are going up, but a sonogram doesn't show anything happening. Doesn't show, right, the baby is not growing where it's supposed to be growing. Ectopic pregnancies are rare. And if you think you're having an ectopic pregnancy, I would like for you to call us. There's an ectopic pregnancy, a molar pregnancy. And those are usually, the signs are that the pregnancy is not developing correctly. So HCG levels are going up, but there's nothing, baby's not growing. So that's a problem. Do you have a right to feel sad when you get your period and you're hoping to be pregnant? We have a right to feel whatever we're feeling. So the answer to that is yes. Now, if you were hoping to get pregnant and you get your period, why wouldn't you be sad, right? You could be married 2 months and you thought you were going to get pregnant right away and you didn't. So you have a right to be sad. Our our feelings and emotions are not dependent on other factors. Because I'm assuming what you mean is that you were hoping to get pregnant, you didn't. Do you have a right to be sad because maybe other people have it worse than you? There's no right or wrong. You have a right to feel whatever it is that you're feeling. At one point, or man's bleeding when you say a woman needs to go to the emergency room. Okay. Woman needs to go to the emergency room if, as I said, the bleeding is so heavy that you are changing your pad more than once an hour. Some doctors will say 3 times, meaning you had to change your pad more than once an hour, but then you didn't have to do it again. So then maybe not. But if you have to do it 3 times, right? So if over the course of 3 hours, you've had to change your pad 3 times, that's a problem. And we want you to go to the emergency room because we want to make sure that you're not hemorrhaging. So that is sort of like the sign that we look for. Do you recommend never wearing dark underwear when pregnant, not to miss any bleeding? Wear whatever you want. Believe me, if you're bleeding problematically, you're going to know. We all know. You're going to know. You're going to feel it, right? We all know the difference between discharge and bleeding. So why shouldn't you wear dark underwear? I don't see that as an issue. I want to just 2 things that I want. 1 second. How soon after miscarriage can you start investigating as to the reason? So first of all, if we're going to do blood work, so there's recurrent pregnancy loss, which is defined in this country still as 3 or more losses. In England, it's 2 or more losses. We would say push, depending on the situation, we might say push for a recurrent pregnancy loss panel, which is a series of blood work to be done after 2 losses. Maybe we would do that in consultation with you if you would call us. But your numbers need to go down, right? Your HCG levels need to go down. So it's usually the 2-week visit. Sometimes they'll tell you a week after. After first loss, there's usually not going to be any testing. It's just generally not done. If it is a stillbirth, they'll check to see if it's a cord issue. But usually there isn't testing. They might do, if you're induced and it's a stillbirth, they might, depends on your doctor, they might offer you some testing. A lot of times they won't, your insurance may not cover it. So, but after 2 or more losses, for sure, after 3 losses, we want that testing, which could be why we may say, or your doctor may say, we need to do a DNC because we want to be able to test. Is getting pregnant right after a miscarriage a loss of problem? There's a huge chilukei deos. Some doctors say you don't need to wait at all. Some doctors will say 6 months, 3 months. We definitely feel even after an early loss, waiting 1 cycle doesn't hurt anybody. And it just gives you processing time. But usually it's a conversation you're going to have with your doctor and then you're going to have with your Rav. Can you please address situation woman gives birth to a living baby too early? So I'm assuming we're talking about preemies, a premature baby. So it's hard. It's really, really hard. Halachically, all of the things are the same, right? The baby may be, a woman may go into labor very early, before a certain amount of weeks, depending on the hospital. They may not do anything for her. They may tell her that if the baby is born, they will not do any life-saving measures. In every hospital, it's different. Some hospitals will say 24 weeks. Some hospitals will say 26 weeks. But premature babies who do not survive, then it's different, but it's not any different, really, in terms of how we navigate than a stillbirth. How soon to go? I'm sorry, I didn't see. How soon to go to the mikveh after a miscarriage? I would want you to speak to your dayan. Our take is let's get you clean as quickly as you can so that you can go to the mikveh. We're not talking about resuming intimate relations. That is going to be a discussion with your doctor when he says you can, but it's about getting past the harchakos so that you and your husband can grieve and mourn together. So our psak really is some women they don't stain for very long. So I think the general rule is as long as you're going to the mikveh, it's going to be 2 weeks after your loss, which is generally going to be anyway. It's chances of it being earlier than that are almost nil. That's okay. That's ARPSOC. But I always say, please speak to your Rav, or you can call us and I will put you in touch with one of our Dayanim. Does checking progesterone levels have a chance of protecting against hormonal factor pregnancy loss? Listen, you should follow the general rule that your doctor lays down. Progesterone is not going to prevent a pregnancy that is not good. Meaning if there are chromosomal issues, progesterone can't fix that. What progesterone can do is stabilize the pregnancy. So it all depends on what's going on, and it is a conversation that you would want to have with your doctor. Now, I want to just go back. So at the very beginning, one of the first things, right, that we talked about was support. So you have this wonderful initiative taking place now in Crown Heights. Khalifa Tarlo is somebody that we are in touch with very, very often. And it is a privilege for us to assist the larger Crown Heights community in any way that we can. So we have our loss packets in Crown Heights. Freddie Lee Brow is the one who, or Hindi Greisman sometimes, is the one who distributes them. I wonder if I have a picture. Some of you may know of our packets. I don't know if I have a picture handy, but it's basically a very, very comforting packet that you open it up and it's just pretty. It says somebody cares about me. It has reading material, both for the wife and for the husband. So it's in English, it's in Yiddish. There are candles and slippers and chocolate and magnets and a coloring book. It's just, you open it up, like I said, it really says like somebody really, really cares, and it's nice. And it has also all of our teleconferences are in there, all of our support group sessions are in there. We do support groups once a month for pregnancy loss. All the information is in there. We do phone support. Our pregnancy loss phone support is answered 24 hours a day. I'm going to actually put the number in so that they will have it. So it's 718-686-8912, and it's extension 113. At the same time, a lot of people have my phone number. I don't have a problem giving it out. So that number is 347-986-6443. And my phone is on 24 hours a day. Sits by my bed. Absolutely not a problem. I do turn it off for Shabbos and for Yantif unless we go into Shabbos with a case. So if I have a woman who's in the hospital, then I'm not turning off my phone. Or if my conversations with her, we just had this 2 weeks ago. We had a woman who we were waiting. Her procedure wasn't going to be until after Shabbos. She was already staining. We were very concerned. We didn't know what was going to be. And so one of us on the helpline kept our phone on for Shabbos. That's ARPSOC. So again, if we know about it before Shabbos, we're keeping the phone on. Otherwise, it is being turned off for Shabbos and for Yom Tov. I think we've covered it all. I want to say, like I said, you could reach out to us anytime. That's what we're here for. We're here to support. And anything. Let's look at last two questions. Okay, in your experience, do most women choose to hold a stillborn baby? Yes, but yes. That doesn't mean that if you choose not to, then you're doing something wrong. We can only make the best decisions we could ever make at any given moment. So we can't have regrets. And we can't look back and say, I wish I had, because it doesn't work like that. At that moment, you make the decision that's best for you. Very often, husband and wife will not agree. Husband will say, no, I don't think you should see the baby. That's good for him. And hopefully we have somebody in the room, either a doula, one of us, or we're on the phone with you and we're helping you guys navigate this. And so we're going to say, it's okay that you have differences of opinion. We each need to do what works for us. So yes, most women do. Sometimes they don't. Sometimes they just want the baby in the room with them. They want to be able to see the baby. But yeah, most women do. And does 2 chemical pregnancies in a row and then normal make you prone? No, there's no set. That's one of the hard things about pregnancy loss, is that so much is, we just don't know. So if you have 2, 3 losses in a row, chemical pregnancies in a row, I want you to call us, because we may send you to an RE, reproductive endocrinologist, to figure out what's going on. In every situation, things are going to be handled differently. We like to say that ATIME doesn't do cookie cutter. So there's no one specific answer for every situation. It's, let's look at you, at what's going on with you. Let's see what the bigger picture is, and then we're going to figure out what we do. You mentioned some doctors not taking out the baby whole by a D&E. Again, it depends on the size of the baby. So that's why we always say you should definitely have this conversation with whoever's doing the procedure. And if the baby is small enough, it's not an issue. A baby that measured 14 weeks was, I would assume, was taken out whole, because babies at 14 weeks are very small. So it shouldn't have been a problem. Yeah. Okay, so the correct thing, can we share some sentences of correct things to say to someone that's experiencing pregnancy loss? I'm so sorry. I so wish this wasn't happening to you. Please tell me how I can help you, or can I do X for you, right? I mean, 2 different situations. Sometimes right? Maybe she has kids at home, so you can say, can I take your kids out? I'm going to the grocery. Do you need anything, right? Sometimes we can ask about practical things to do. Other times we're simply saying, I'm here, I love you, I care about you. Tell me what you need. Do you want me to just sit with you? Because I could do that. Do you want me to just be on the other end of the phone? I can do that. Validate her pain. Don't ever make it about you or say, oh, I heard a story. No. It's just really about her, about him. Call him. Say, how are you doing today? Do you want to talk? Do you want, you want to go out? You want to just, see if you know them, right? And I'm assuming that you're only going to be helping somebody who you know. Then think about what that person likes to do, and then see about helping them do it. And sometimes all they're really going to want, sometimes they may want to be left alone. And so then that's what we want to respect. One of the things that a text message can be as simple as, I heard and I'm so sorry. Please know that I love you and care about you. Could be that's it. I always tell women, and I tell this to mothers, we need a gatekeeper. When my daughter had her loss, I was the gatekeeper. She said to me, Ma, I don't want to talk to anybody. So even to my other children, I told them what happened, and I said, she doesn't want to talk to you. She knows you love her. She knows you care about her. She said you could text her. So you could text her saying, I love you and I care about you and I'm here for you, but that's about it. And if she doesn't answer, then that's fine. Know that she got your message, but she doesn't want to talk to you. It was very, very hard for me to tell that to my mother. It's in the other room, which is why I'm whispering. But I had to say that to her. She's like, what do you mean? Why can't I call her? I said, because Mom, she doesn't want to talk to you. She doesn't want to talk to anybody right now. She said, can I text her? And I said, yes. And you're going to text her and you're going to say, I love you. And I'm so sorry. And that's it. And that's all you're going to say. I'm sorry, one more time. So please address how long women can expect to bleed after a loss. Okay, I'll get back to that in a second. So that's what you can say. You can say, I care and I want to help. Either tell me how I can help you, or can I do X for you? Those are the best things to do. Or if she's your really, really good friend and you know she loves something, then get her that something that she loves, so that she feels cared for, that she feels valued. That's really, I always think that in the post-loss world, we feel so much was taken away from us. We had no control over what happened. So whatever control we can give back to them, that's what we want to do. We want to give them control. So not, it's, I made lunch. You want to come out and eat it? No. Do you want to eat lunch? And if the answer is no, the answer is no. Those asking the questions is really important. How long a woman can expect to bleed after a loss? It's really relative. Each individual person is going to be different. Some women will stain. It's normal to stain for a couple of weeks after. That is normal if the bleeding is heavy for long periods of time, or if we're talking 3-4 weeks and the staining hasn't stopped, then we want to take a sonogram. We want to make sure that there's nothing retained, that could be causing that problem. So it is normal. Sometimes after a stillbirth, you will have less, just like there are some women who 2 weeks after a baby are stopped bleeding, and then there are some women who bleed for 6 weeks. So there is no set time. Everything is relatively normal. But as I said, if your bleeding gets heavy or if it doesn't stop at all, meaning sometimes we can, we're bleeding post-loss and then it stops, a woman will call me and she'll say, I started counting and then I started bleeding again. That's normal. But if you never got clean at all, then I want you to speak to your doctor. I want you to call us because we may suggest that you go for another sonogram. But there's no specific amount of time that you're, past this, oh my gosh, this is terrible. If it's, like I said, 3 weeks, 4 weeks, and you never got clean at all, we need to figure out what's going on here. Did we cover everything? I know. Okay, looks like maybe we did. Okay.
Yes, we did. Thank you so much, Mrs. Chumi Friedman, for all the compassionate and important information on guidance, on support, on the medical things that women would need to know. It is invaluable and incredibly important. So thank you so much. I want to just point out one of the messages I was given. So I just want to make sure that people should be aware that anytime someone has a miscarriage or a stillbirth, it is really important that it is marked on the calendar and that you check with your Rav based on that as to what dates to anticipate for illness of separation. I also am, if you don't have the app, then please call your Rav. If you're not entering it, call a Rav and ask them how you plan your illness based on the date of the miscarriage. It will vary based on your individual factors. So please call a Rav every time. I'm going to post again the information. Mrs. Chumi Friedman had mentioned that Mrs. Chaviva Tarlow and Shalom Womofsky run a program called With Love in Crown Heights, offering support for women suffering a loss. I mentioned it at the beginning, so I'm going to mention it again now. I'll post information here in just 1 second, so don't sign up just yet. And also, if you're not in Crown Heights, the book that they include in their packet is called A Child I Never Knew. It is available at the mikvah.org mall. And again, I will post that again over here. So without any further ado, thank you very, very much, Mrs. Chumi Friedman. Next week, we will be having the second class in this series called Before, During, and After, the halacha, the hashkafa, practical and medical surrounding the very special time of pregnancy and childbirth with Mrs. Mushki Kotlarski and Mrs. Rivki Biarski, a registered nurse. Again, please follow us on social media to get all the details and make sure you don't miss out on any of the important classes. Thank you again, Mrs. Chumi Friedman. It was fantastic and good night. Okay, and I'm just going to wait one more second here so I can just post all the information so everyone can see it, since unfortunately it seems like people were having a hard time seeing the chat. So I'm going to give that here for a minute. To contact With Love, you can write withlovegiving@gmail.com, or you can WhatsApp the organizers at 347-389-4656. They're also working on a website to help streamline the process of seeking support. And once again, I also mentioned this book, so I'm going to put that here. Mikvah.org has published a short essay from fellow mothers, and the link is at mikvah.org/mall. It's called The Child I Never Knew. Next week, again, we're going to be talking about before, during, and after navigating the special time of pregnancy and childbirth. And I look forward to greeting you all then online at midford.org/live or on our Facebook feed. Good night, everybody.